Doctor, you mentioned that you will practice chelation on cancer patients. Can you talk about some of the results that you see? And that's, I'm assuming that's not the only therapy that's provided either. So, but can you just talk
Well,
about some of the results?
well, I think that the chelation is much better for preventing cancer than for treating it.
Okay.
As I said, people seem to do better in many ways when they're taking the chelation. But for dealing with cancer, with intravenous treatments, I like vitamin C.
Mm-hmm.
I like oxidative therapies. But vitamin C in very large doses has a pretty good track record for treating cancer. Linus Pauling, remember Linus Pauling?
Mm-hmm.
He had 2 Nobel Prizes, wrote some of the greatest stuff on vitamin C. He did a study with Ewan Cameron in Scotland many years ago. And in Scotland, it's part of the UK, United Kingdom, they had socialized medicine, and they did not use chemotherapy on solid tumors because they said it did no good. It was just an expensive damage to the patient. And Cameron and Pauling decided from various reports that they figured out that if they gave 10,000 milligrams of vitamin C a day orally to these cancer patients, they could get a 30% increase in longevity. Well, if someone has 2 months to live or 3 months to live, a 30% increase in longevity is not earth-shaking. So you live another month and with cancer. That wasn't the important part of the study. What they found, they carried on the study for 8 years. And what they found is that about 8% of the people in the study were alive after 8 years. And they had been given, a few months to live. So to me, that's very powerful evidence for vitamin C. Not only that, there's a Dr. Hugh Reardon, who unfortunately is dead now, but he did great work in Kansas. He figured out the threshold dose of vitamin C by measuring the vitamin C levels in the blood after giving a huge dose intravenously. And he would give 50,000 milligrams, 60,000, 70,000 milligrams of vitamin C. And he got tremendous results with patients with cancer. And he gave it fast so that he would achieve a blood level about 100 times higher than you could get with oral vitamin C because you can't absorb it quickly enough.
Okay.
So the maximum blood level you can generally get with oral vitamin C is about 4 milligram%. With intravenous vitamin C, given rapidly, you could get about 400 milligram%. And he found, but he had his own lab in his office, so he could measure right there the vitamin C levels. And he found that by getting the vitamin C up to 400 milligram%, he could have a tremendous effect on controlling cancer growth. So, and vitamin C, even at that level, is virtually harmless in most cases. There are exceptions to it. If you have a certain kind of metabolic quirk like a G6PD dehydrogenase deficiency, you don't have to remember that.
Okay, good. Well, in talking about vitamin C, when you hear about results like that, and we've heard lots of instances, do we know enough about how it works? What is it doing?
We don't know everything by any means, but we know that that vitamin C, when it gets inside the cancer cell in high concentration, it converts to hydrogen peroxide.
Okay.
And hydrogen peroxide kills invaders. Now, hydrogen peroxide, most people don't realize, I don't even think most doctors realize, that vitamin C taken, not vitamin C, that 20% of the oxygen we breathe becomes hydrogen peroxide at some point in our metabolism. Did you ever hear that before?
I have not.
So I think it's an important part. So in the metabolic process, oxygen goes through a lot of stages, and one of the stages is hydrogen peroxide. That means you've taken H2O, water, it's 2 hydrogens with 1 oxygen, and you've made it into H2O2. So you've given an extra oxygen atom. This extra oxygen atom has a minus charge to it, so it's actually a free radical. Now the free radicals are usually bad guys, but this is a free radical that's mostly a bad guy for invaders. So the white cell takes this manipulation, this metabolic manipulation, and it takes the H2O2 minus, splits off the minus oxygen, and kills bacteria and kills cancer cells. That's one of the theories, and there's a fair amount of evidence to support that.